I hear you've just been diagnosed with anal cancer. I'm sorry to hear it. But the good news is that anal cancer is quite curable, and more than 90% of patients are completely cured and live quite healthy and normal lives afterwards. Hi, my name's Nav Sharda. I'm an oncologist here at the Cancer Care Centers in Las Vegas, Nevada. I've been treating patients with anal cancer for over 30 years, and as such, I've seen the changes in therapy. In the past, it used to be primarily surgery, and patients were not happy with that outcome. And there was a lot of failures as well. But then in the late 1970s and early 1980s, a brilliant oncologist by the name of Nigro, he came up with an idea where he combined chemotherapy with radiation therapy as the primary treatment for anal cancer. And amazing, most patients, the tumor just completely disappeared and never came back. So we had an answer to the anal cancer problem. But the side effects that most patients come to me and are concerned about, that was always the issue. So I've been dealing with side effects of therapy my entire career. And I'm happy to report that side effects have gone down a lot. We've gotten much better at the medical management of the chemotherapy and the chemotherapy complications. But more importantly, we've become much better at delivering radiation therapy. So in the past, radiation treatments were delivered in two different directions, an anterior direction and a posterior direction. And anything that was in between those two fields received quite a lot of radiation treatment. And sometimes the skin just couldn't tolerate it. Nowadays, we deliver radiation therapy in many different directions. There's something called dynamic arc intensity modulated radiation therapy, which has become almost the standard of care now. I started doing that back in 2003, and it has made a world of difference for most of my patients. By delivering treatment in 360 degrees, you can focus in just where the tumor is, and you can actually shut the machine down on when the radiation would be approaching areas that are very sensitive in the body. So by doing this, complications of treatment go way down as well. So what would you expect from from therapy and from a consultation with an oncologist? Well, first we would want to see whether or not the tumor has metastasized. And the way that you do that is by checking with either CAT scans or something called a PET scan, a PET scan. And what that does is it is a small injection of radioactivity, and it goes through your whole body. And then you go through a radiation ring detector, which identifies any part of your body that might have abnormal uptake. If there is abnormal uptake, we'd be concerned that the cancer may have spread. But the vast majority of anal cancers, even if they're really, really large, have never spread. And so they're quite amenable to curative treatment. There's a lot of other things that we would need to talk about in terms of your health and detoxification and improving your systemic ability to tolerate therapy and to recover. But those are all stuff that we have to talk about individually in a consultation. So, to your health, this is Dr. Nav Sharda at the Cancer Care Centers in Las Vegas.